You got to keep them away from the bad stuff because that's where the problem lies. Okay?
Okay.
Very good. Question?
Hi, Dr. Wallach. Thank you for coming.
Thank you.
My question is, what can I do or use for gait imbalance? I have, my body wants to go straight, but it leans, and sometimes I have difficulty walking.
Okay, now, is this, she has a balance problem. Now, is this a...
cerebella something?
Okay, were you born this way?
No,
Okay,
not to my
then
knowledge.
it's not cerebellum.
Well, that's what the doctor said.
Okay, yeah, it's not cerebellum. It's not cerebral palsy. If you were born normal,
Right.
how long ago did this develop?
It's been going on for about a year and a half.
Okay, so a year and a half. Yeah, so it's not a genetic defect. It's not a congenital defect. You weren't born that way. And this can be due to osteoporosis of the skull,
Okay.
or you could have one hip, one leg shorter than the other. I mean, there's all kinds of possibilities here. But if it has to do with the brain, doctors forget that you get osteoporosis of the skull, just like you do your legs and your pelvis and your vertebrae. When you have osteoporosis of your skull, the bones get thicker. Oftentimes they called Paget's disease. And when it gets thicker, the canals that the nerves come through, there's 12 pairs of cranial nerves. 12 come out this side from the brain, 12 come out from this side of the brain. And the one that affects your balance, and you feel like you're maybe in motion, do you ever get like motion sickness, a little nausea with it?
Yes, sometimes.
Yeah. Do you ever get ringing in your ears?
No.
Or no tone or chirping or anything?
No.
Okay. But if you feel a little nausea sometime, and you feel like, man, the room is swimming, like motion sickness, this could be caused by osteoporosis of the skull. And the canal that the 8th cranial nerve is going through is filling up with scar tissue because you have osteoporosis of the skull. And when you squeeze the vestibular branch of the 8th cranial nerve, in the old days you used to call it Meniere's disease, and today they call it Wallach's vertigo because they figured out what causes it.
Right.
So what you need to do, you're a tall girl, so you're going to need 2 healthy bone and joint packs per month.
Okay.
2 full doses a day, a full dose of breakfast and dinner, 2 healthy bone and joint packs per month. And you also want to, in each one of those healthy bone and joint packs is going to be a wide-mouth jar of CM cream, which is a topical pain reliever, anti-inflammatory. You're going to take a 1/4 teaspoon with a Q-tip in the morning when you wake up, put it down in your ears, like you're trying to get wax out, and then in the middle of the day, like 3 o'clock, kind of halfway between lunch and dinner, do it again.
Okay.
And if that's correct, what will happen is you're going to see relief for 3 to 5 hours.
Okay.
Be different. And if it's in your hips, then it won't affect it at all because it's in your hips.
Okay. Thank you so much.
You're very welcome.
Have an amazing day.
Oh, yeah. Well, I'm just being here with you is an amazing day. Thank you, dear. Okay, back to you.
Okay. My son, he's 4. He has severe allergies. He's allergic to the top 8 and corn and sesame seed. He has extreme itching, eczema. I haven't seen his skin clear since he was born.
Okay, so he has eczema. Does he have any respiratory stuff or bowel things?
He had he was getting colonoscopies, endoscopies.
How
when
old
he
is
was
this
first
child?
Born. He'll be 5 next month.
5 next month. They're doing a colonoscopy on him.
Tonsils, adenoids.
Yeah,
removed.
we need a new doctor here. Okay, doing a colonoscopy on a 5-year-old kid. Somebody needs to go to jail here. I could say some things, but I won't. Okay. I'm getting breathless here because of this. Okay. Basically, when a child has eczema and bowel problems, it's because they have what? A gluten intolerance.
Right.
Now, did you have asthma as a child?
No, his father did.
Well, it's not going to come from the father.
Yeah, I did.
Okay. Even if the father had asthma, it's not going to come from the father. Do you have any other children?
No.
Do you have any brothers and sisters?
Yes.
Do any of them have asthma?
Yes.
Bingo! There we go again. Okay? So, yourself, your husband, the boy's father, your brothers and sisters, your mama if she's still alive, all your mama's brothers and sisters, your aunties and uncles, all of them got to be gluten-free. Okay, and what does this child weigh?
He's almost 40, and he is gluten-free now, though.
I don't believe it. Are you gluten-free?
Allergic. No.
Well, then he's not gluten-free.
Okay.
Are the dogs and cats in the house gluten-free?
He's allergic, so we don't have any.
Okay, what about anybody else living in the house? Grandma?
No. Just
Does he
us.
go to babysitters?
He's at the daycare.
Daycare? Are they all gluten-free?
Do you mean in the environment?
Yeah.
Oh, okay, yeah, no.
No. And so he's not gluten-free then.
Okay.
Okay, cross-contamination in the food preparation surfaces, the couch where people watch TV, hugging people that just had toast for breakfast, all the crumbs all over their clothes. Even the daycare person,
Right.
they had a breakfast sandwich at McDonald's and they're full of gluten in their hands, and they take the child's hand and the child puts his hands in his face, and so dog food, for those of you who do have dogs, the dust from the dry dog food or dry cat food gets on you. The laundry where people wash their clothes, you wash your clothes in the same laundry as your child.
No, I separate that.
Say again?
I do it separately.
I don't care if it's separate, it's the same washer and
okay.
dryer. Yeah, I was getting
Right.
cross-contamination.
Okay.
I mean, you need to clean this environment up. I mean, really be obsessive about it, okay?
Okay.
And then the child weighs 40 pounds, you say?
Yes.
Okay, so approach it as 50 pounds. So it'll be one healthy brain and heart pack. Can last him 2 months. So a half a dose a day for 2 months, right? And then you need to get another one. As he gains weight, the dose needs to go up. And this should go away fairly quickly, okay? But I would get another opinion before you start doing colonoscopic exams on a 4-year-old.
I stopped taking him to the doctor.
Oh, good.
Yeah.
Bless you, yes.
Okay.
Yeah.
Okay.
Because, you know, how many of you have heard of the trouble with priests who are predators on the choir boys and stuff like that? Well, there's lots of sexual predators who become pediatricians. So think about that. Yes.
Yes. God bless you, Dr. Wallach.
Thank you.
Concerning pain, wherever the pain may be, because I believe because I'm a praying man, I haven't taken pain medicine in like 3 weeks, and I feel the same way I felt when I was taking the pain medicine. So what would you prescribe?
Okay,
for
now pain, you're talking about muscles, soft tissue, you're
Just
talking about
in
joints?
the body, in here.
Every place.
Yes, sir.
Okay, have you ever had a diagnosis from anybody? Like
Yes.
fibromyalgia or arthritis? I mean, what did they tell you? I mean, you know you have pain. You didn't need to go to a doctor to say you have pain. So what did they tell you?
They're saying that I had the condition, and because
What
it's-
condition?
They said I had arthritis. I don't believe
Okay,
it.
so let's say you have arthritis. You're a big fellow. You need 2 healthy bone and joint packs per month,
Okay.
right? Full dose of everything twice a day, except for the glucogel. You're going to take 15 a day, and all that would be accomplished by the 2 healthy bone and joint packs. You can use the CM cream topically on your knees, your hips, your elbows, or shoulders, or neck, wherever you have the pain. Soft tissue, muscles is fine. And what kind of work do you do?
In hospitality, catering.
I'm sorry, say again?
Hospitality, catering.
Hospitality.
Food and beverage.
Okay, you're not the cook, are you?
No.
Okay. And you're rolling out flour and bread and stuff. Okay. Yeah, you want to stay away from that kind of stuff. And none of the bad foods, no fried foods, no processed meats, no gluten. And also, you want to stay away from carbonated drinks, even ones you think of as being benign. Things like ginger ale, club soda, sparkling water, because the carbonation actually neutralizes stomach acid. It's going to prevent you from absorbing minerals. And so you got to stay away from all the carbonated drinks too. Okay?
Thank you.
Your bet. Yep. Question?
Hi. I got sick about 3 or 4 years ago.
You want to step up to the microphone a little bit? Thank you.
Okay, I got sick about 3 or 4 years ago, and I had pain. And before I knew it, I was in the hospital. The kids took me to the hospital, and they examined me just like that. And the doctor said, "Oh, your gallbladder is shot. We're taking it."
So you took your gallbladder
They
out.
took my gallbladder. So I want to know, because they're saying I don't need it. I don't believe that. So is there
Well, God put it in there.
something-
You need it.
Yes, my point. Yeah. So, I mean, is there a vitamin I can take? Is there something I can do to offset all
Sure.
that?
Now, the question is, do you still have any discomfort in your belly?
No, and it
Okay.
wasn't discomfort. I didn't even know I was sick. I thought I was having a heart attack. It was my first event. It just happened.
Oh, he said you had a heart attack.
No, I said I thought I was having a heart
Oh, okay.
attack, but they said it was my gallbladder. But
Okay.
I had never gotten sick before for that.
Okay. Then, do you have any skin problems, any eczema, dermatitis, psoriasis?
I've been in remission with the eczema for about 20-some years.
20-something years, okay. Guess what? You have gluten intolerance.
Okay.
So you need to get off of all gluten. No wheat, barley, rye, and oats. No fried foods, no processed meats or oils, right? All that's got to go.
Okay.
Now, the gallbladder, 99% of the time, is innocent. The gallbladder is just a bag. And if you had any stones in there, gallstones, they're made in the liver, and the liver drops them into the gallbladder. And so taking out the gallbladder is kind of insane, because that's like amputating a weightlifter's arms because he's got a big arm, because he's been weightlifting, right? And so what I would do is go ahead and take 2 of the healthy brain and heart packs per month, which is very good for the liver, full dose of everything twice a day. And then specifically, we have what we call the gallbladder in a bottle. It's a digestive program, and I want you to take 1 or 2. You'll decide which one's better for you. 1 or 2 of those ultimate enzymes. They're called ultimate enzymes, like 1 to 2 minutes before each meal with a couple ounces of water. It'll be maybe 1 bottle a month. And we call it a gallbladder in a bottle because it has bile in it to help you absorb all the good fats, including fat-soluble vitamins, A, D, E, and K, good cholesterol, all the stuff you need to absorb. You have to have bile from the liver to do that. And your gallbladder just stores the liquid bile. And when you have a meal, it'll kind of squish and all that bile goes in your intestines and helps you absorb those good fats. So you do need that, and so that's why we have the gallbladder in a bottle called Ultimate Enzymes. Take 1 or 2 of those, 2 to 5 minutes for each meal, a couple ounces of water, okay?
Okay, thank you very much.
You're very welcome. Okay, question?
Yes. Dr. Wells, thank you for being here.
You're very
I am
welcome.
diagnosed with macular degeneration. And I do have a spot in that right eye. And that's why I want to know.
Okay, she has
what-
macular degeneration. Did you drive here yourself today?
No, my niece brought me.
Okay, can you drive?
Yes, I can.
Okay. Macular degeneration is free radical damage to the lining, the retina of the eye. And it's easily prevented and it's easily reversed. It's not genetic in any way, shape, or form. It's caused by free radical damage to the eye. So you got to change everything you're doing. No fried foods, no processed meats, no oils, no gluten. All that's got to go. I want you to remember that the eye is part of the brain, okay, and the brain is part of the eye. It's the brain has the optic nerve, goes through the skull, and then the eye is a ball, ball on the end of that optic nerve. So it's all part of the brain. So you need to get rid of all the bad stuff, and particularly things that produce free radicals. No fried foods, no processed meats with nitrates, nitrites, no oils, no gluten. And you want to take 2 of the Healthy Brain and Heart packs per month, a full dose of everything at breakfast and dinner. And then I would also get your auric points, your antioxidant points up to get rid of that damage. It's kind of like having really severe age and liver spots in the lining of your eye. And so what I want you to do is there's 3 things you can take to get your auric points up. And you kind of mix them up, one this week, another different one next week, and so on. So you can have a little variety, or you can do all the same thing. It doesn't matter. You need to get your auric points, your antioxidant points above 100,000 per day. Auric is an acronym which stands for oxygen radical capacity, which is a measurement of how many free radicals are neutralized by the antioxidants in the product. At any rate, you can do that with either what's called Cell Shield RTQ. Take 5 of those twice a day. Or you can take triple treat chocolate, which is kind of fun. You take 6 of those a day, 2 at breakfast, lunch, and dinner if you like chocolate. And, or you can take what we call the Beyond Tangerine BTT 2.0 tablets. I'd go ahead and take 3 of those twice a day. It'll be 2 bottles a month. And that's going to get your auric points above 100,000 a day. Now, the BTT 2.0 tablets is a fairly economical way to get really over 300,000 auric points a day. For me, I would do the BTT 2.0 tablets because I'd want 300,000 auric points, although 100 will do the job. But my vision is important to me, so I'm going to go with the BTT. But any one of them will work. You can mix and match them, get over 100,000, and these guys out there will help you do that. And I made a bet with a doctor once who called me a liar who was in the group. And I said, I can reverse macular degeneration even if you're legally blind for 6, 8, 10 years. He jumped up and said, Wallach, you're a liar. I said, well, sir, who are you? He says, well, I'm a medical doctor, eye doctor, and absolutely it can't be done. It's an age thing, and you can't stop it or prevent it or cure it. I said, well, sir, that's not correct. You want to do a little wager. And he said, yeah, I'll do a wager with you. He says, well, bring me 12 of your patients that are legally blind, 6, 8, 10 years of macular degeneration. And if I could get half of them in 90 days, 6 out of the 12, to read 20/20, would you apologize? He said, if you could get 1 out of 12, I'll apologize. So the next day, he brought me a box of 27 charts. True story. Brought me 27 charts. I had 300 witnesses in the room. And he says, here, pick your 12. And I said, well, who's going to pay for all the supplements? He says, well, let's make that part of the wager. If you win, I'll pay for it. If I win, you pay for it. I said, well, that's fair. I said, if that's the case, let's go for all 27. He says, you're on. So I filled out a form, as you're going to have filled out there, and I personally gave it to each of the 27 patients. I talked to each one because I didn't quite trust him. I didn't know if he was going to kind of purposely deep six it so he could win the bet. I don't know, because I didn't know him. And so I talked to each of the patients and gave them a handwritten thing of how to take the supplements. 90 days later, all 27, praise God, could read 20/20. Only 2 required glasses to make it happen. The other 25 didn't even